Okay, so now that we understand how to use ultrasound and all the effects of the ultrasound, now we're going to talk about how we use that in combination with eStim. So ultrasound and eStim together, or what we usually call combo, combines the effects of both treatments. eStim is delivered through the sound head. So we end up with a monopolar setup where we have a dispersive pad and the ultrasound head becomes the active pad. It's really the best results that I've had using combo are for muscle spasms and trigger points or to get some sort of a massaging effect. Because what you do is as you move the ultrasound head around, you'll actually get these contractions that are occurring. Even if we have our eSIM set to potentially not be contractible, we tend to still kind of get this waving action of these massaging techniques. So even though we could use ultrasound and eStim strictly non-thermal and with high rate, it's used much more so in situations where we'd actually want some sort of muscle contraction to break up muscle spasms, to help break up the trigger points, and to help get that massaging effect. We get a lot of increased circulation, again, decreased muscle spasms, decreased adhesions. It will produce kind of those muscle contractions, so it's really good for trigger point areas where we can kind of fatigue those trigger point areas out so that they can't spasm on their own anymore. We get usually increased ATP creation, which helps with repair. We get increased phagocytosis. We get more waste removal because of that increased circulation. So we can get some really good benefits. We can do 1 megahertz or 3 megahertz depending on the depth of the muscle we're targeting. It just kind of depends on that. Again, if we apply it while on a stretch, that usually helps with the trigger points and the muscle spasms as well. But what we need to do this is we need to set up our treatment time to be determined by the ultrasound. So again, usually we're talking about heating. If we're talking about doing non-thermal, then we usually have a 10-minute treatment. But our treatment time is usually determined by that heating. So using our chart, figuring out our treatment time, and then, understanding that we add 3 to 5 minutes at maybe a lower intensity to try to keep the temperature at that treatment. We do our monopolar setup with the ultrasound being the active electrode. We use our conducting medium and keep the head moving. So as we're setting up our treatment, when we're getting the stim's going to be coming through the ultrasound head. And so we need that in contact, right, to close the circuit in order to get the eStim set up. But we do want to be kind of moving that around a little bit just so that, again, we always move the transducer head. But for sure, when we go to set up our ultrasound setup, then you're definitely going to want to make sure that we're keeping the ultrasound head moving. And we'll have a video on how to set up combo on the 3 different machines that we have. So we could use any of our eStim pain relief parameters. So biphasic, pre-mod. We can't use IFC because we need a monopolar setup, but we could use high volt, we could use tens, we could use our high rate or low rate tens. It doesn't really matter. Again, it depends on the goals of this patient. And then we get a desired effect. So we can either kind of get that tetany where we get a really kind of tight muscle contraction as we kind of move around, or we can get more of that pins and needles massaging. Maybe there's kind of a little bit of contraction, or potentially no contraction at all. But again, most of the time we use it to get contraction. So this is what this typically looks like. So they just have a typical sticky pad on, but ideally you can use our bigger dispersive pads as well. Our treatment area still has to stay small, okay, especially if we're trying to heat. So we still only want about 2 times the ERA, 2 to 3 times, and keep it small. So target those trigger points, target where those muscle spasms are. And again, as you kind of move around, you're going to see the muscle be able to contract. So you'll want to watch the videos on how to set up that combo treatment on the different machines.